So if you were here today with low back pain, we talked about 3 different exercises. And the reason for these exercises is mainly because we want to start getting movement patterns restored. And one of them is going to be lumbar neutral and your hip hinge pattern. We talked today about hip hinging because it's important to remember that when you bend over to do anything like picking things up off the floor or putting your socks on in the morning, you don't want to compromise that curvature of your low back. So I have Sean here that's going to demonstrate a hip hinge squat. So notice as he lowers himself down here, again, that he's keeping pretty good alignment with his legs. But what I could have him do, and most of you guys do this, is I could have him keep his chest up, stick his butt out slightly, and keep that curvature. Again, that lumbar curve is positioned like this. So imagine trying to move without compromising that position, which means you're not going to lower yourself down and get tucked under. You're going to maintain lumbar neutral while you do the door squat that I taught you today. Go ahead, Sean. Yeah. Now step into the lateral a little bit. You got it right there. Go slow, slow. Other things to add on this movement pattern here. Dr. McGill's ideas, hip hinging and lumbar neutral, are extremely important, but I'd like you to also tie it together with 2 other important variables. So one is, Sean, I want you to keep some tone in your abdominal muscles and your quads before you start to lower yourself down. Then go slowly as you lower yourself down. Much better. Even slower than that. Slow. Feel the weight coming into your abdominal muscles. Feel the weight coming onto your quadriceps. And now we're going to tie in a 3rd element here, is breathing. Remember the intrathecal space. A lot of times when there's a lumbar disc irritation, and these exercises that we're reviewing right now really regard themselves for lumbar disc problems. It's the primary reason why most of you guys are coming into physical therapy and chiropractic offices, is that your lumbar discs are irritated. And the idea here is to make sure that we don't put a lot of demand on those irritated discs. It's like having a bruise inside your body. So it's important to also breathe, because if you hold your breath while performing these motions, you're going to put pressure in the intrathecal cavity where that disc is bulging backward towards your nervous system. In the case of sciatica, it's generally bulging back sufficiently enough where you're actually feeling sharp shooting pain going down your leg. So we're going to again make the distinction, but these exercises are valuable for whether you're dealing with just a garden variety of low back pain or an extreme version of back pain called sciatica. Okay, Sean, so I want you to take a deep breath before you lower yourself down, and then as you go down, exhale and keep the pressure out of the system. And exhale up. So take a deep breath on the way down, pause, exhale back up. Excellent. So just as Sean's performing right now, this is exactly how you want to do the door squat that I showed you today when you're here in the office, okay?